Hey everyone, Stuart from Body Fit Solutions. I'm going to be running through 4 basic myofascial techniques using a lacrosse ball. We're going to attack the pecs, the lats, the mid-back and the upper trapezius. Many of you probably right now are watching this from a mobile phone. People spend a lot of time on mobile phones and sitting at desks and driving, etc. And this can wreak havoc with their posture, in particular the cervical spine. We get a lot of head posture forward and flexed upper back. This is going to help to get you out of trouble. It's going to help you to breathe more effectively. It's going to help you to rid of your headaches, any neck pain, any shoulder tension, anything like that. So the first one we're going to work through is the lats. Okay, everyone, here's the first one for your lats, your latissimus dorsi, your upper back muscle. Why do we need to release this? But generally people operate from an anterior pelvic shift, meaning the arm is going to be behind the hips, meaning that your lats are going to be chronically tight. We're going to start in a sideline position. Okay, use your hand as a cushion, or you could use a towel or some pillows. We position the ball into the side of the lats, and I want you to just feel first. So relax the head. You want to be look for that dense region and allow gravity to do its work. As you release, relax best you can, breathing deep. That way your body can conform around the ball and adapt to it. I've not done mine for a while and this feels pretty good. Make subtle, slight adjustments, but try and relatively work into the tissue and just work on your breathing techniques. Just try and relax as best you can. Round about 2 to 4 minutes each side is a good place to start. Awesome, there's the lats. Okay, the next one we're going to work through is your scapula, your mid-back. This is a really awesome one for the upper thoracic region. It's a really effective technique that will help to balance the structure of your body in regards to your shoulder blades and your upper back. Start off with the ball against the wall. It needs to be going almost adjacent to the shoulder blade. I would take it not onto the obviously your spine or the shoulder blade, but just in between, and press that into the wall. What I want you to do next is grab your arm and then passively just gently pull it across and get a little feel. I'll try and show you from this side there where I'm working into. I'm going to start to lay down some pressure. Okay, try and go near the spine, but don't go onto the spine. Remember, muscles are being pulled towards the spine in that regard, and this will allow the scapula to abduct more. It will be painful. Make mindful, intuitive movements, trying to chase the pain, feel out where it needs to work most. 2 to 4 minutes each side. Jobs are good. Okay, for the pec release, we're going to work into your pec minor, which is your upper chest, just below the clavicle, right underneath. It gets tight on people when you have that kyphotic posture of the rounded shoulders, like I explained earlier. So we're going to work into that tissue, into the wall. What I want you to do is press and lean into that wall, create a little bit of pressure. Arm out turned with your palm flat. And I'm just going to start to get some release in that tissue. This release employs better shoulder range of motion and function. And I can tilt my head to the side. I can almost, once you get some release there, just start to rotate my body away from the wall, so I'm getting a bit of a stretch into the pec tissue as I release it. Again, 2 to 4 minutes each side, just below the clavicle. Okay guys, the last one we're going to work through is your upper trapezius. I would advise you to go to the pecs, the lats and the mid-back first, because these are the ones that generally bring in that kyphotic rounded shoulder posture. And then we can help to release this. This will be more reactive to what we're going to do once those areas have been released first. So again, ball, wall, place it into that upper trapezius area. This one feels really nice. And then when you angle yourself, okay, I can tilt my head away from the ball, just try and tweak the angles a little bit. It's nice to be done also on a corner wall as well if you have that. Feels good. And again, work into that breathing. Try and go to those areas that feel more dense, feel like they need the release. Again, 2 to 4 minutes each side. It'll really help you out. Hope you enjoyed all that. Follow it at home. Best of luck.